Coronary artery disease, often referred to as CAD, is a condition that affects millions worldwide. It's crucial to understand what it is and how it impacts your heart health. CAD is the world's leading cause of heart attacks, making it a significant global health concern. Recognizing the risks and taking preventive measures is essential for a healthier life. Your heart, like any other muscle, needs its own dedicated blood supply to function correctly. This vital blood supply is delivered by the coronary arteries. Think of them as the heart's fuel lines, ensuring it receives the oxygen and nutrients it needs. When healthy, these arteries are open, smooth, and flexible, allowing for optimal blood flow. This ensures blood can flow freely and efficiently to the heart muscle. CAD begins when plaque, a substance primarily made of cholesterol, starts to accumulate. This plaque also contains fat, contributing to the overall buildup, and calcium builds up inside the artery walls, gradually narrowing the space for blood to flow. Over time, this buildup narrows and hardens the arteries, restricting blood flow and compromising heart function. This gradual process of hardening and narrowing is called atherosclerosis, a key factor in the development of CAD. As arteries narrow due to plaque accumulation, blood flow to the heart muscle drops, depriving it of the oxygen and nutrients it needs to function properly. This reduced blood flow can cause chest pain, often referred to as angina, a warning sign of underlying heart issues. If a plaque ruptures and a clot forms at the site of the rupture, it can block the artery completely, cutting off blood supply to a portion of the heart. This sudden and complete blockage causes a heart attack, a medical emergency where part of the heart muscle begins to die due to lack of oxygen. Without quick and effective treatment, the damage to the heart muscle can be extensive and life-threatening. Understanding how CAD develops and progresses is the first and most important step to protecting your heart and taking control of your cardiovascular health. Coronary artery disease, or CAD, develops slowly over time. It's a gradual process that affects the arteries supplying blood to your heart. Often this development occurs without any noticeable symptoms in the early stages. You might feel perfectly fine, unaware of the changes happening within your arteries. CAD is driven by a combination of lifestyle choices and your genetic predisposition. Both play significant roles in its progression. Major causes include consistently unhealthy diets, particularly those high in saturated fats and cholesterol. A significant lack of regular exercise also contributes heavily to the development of CAD. And of course, smoking is a major risk factor that significantly accelerates the disease. The risk of developing CAD increases significantly with age as the arteries naturally become less flexible. A family history of heart disease also elevates your risk. High blood pressure puts extra strain on your arteries, increasing the likelihood of CAD. High cholesterol levels and diabetes are also significant contributors to the disease. In its early stages, CAD may present with no noticeable symptoms at all. But as the arteries narrow due to plaque buildup, you might start to feel chest pain or discomfort. This chest pain or pressure is especially common during physical activity or exertion. Other warning signs to watch out for include shortness of breath, even with minimal activity. Persistent and unexplained fatigue can also be an indicator. You might also experience pain in the arm, neck, or jaw, which can sometimes be referred pain from the heart. Some people, and this is especially true for women, may primarily notice feelings of nausea or experience dizziness or lightheadedness instead of more typical symptoms. It's crucial not to ignore these warning signals from your body. Early recognition and intervention can be vital in preventing a heart attack and other serious complications. If you notice any of these symptoms, it's important to talk to your doctor promptly for evaluation and guidance. The cornerstone of battling coronary artery disease, CAD, lies in proactive prevention. It's about making informed choices and adopting habits that shield your heart. Nourish your body with a balanced diet, giving prominence to an array of fresh and colorful fruits. Embrace the goodness of vibrant vegetables, ensuring a rich intake of essential vitamins and minerals. Incorporate whole grains into your meals, opting for options like oats, quinoa, and whole wheat bread. Minimize your consumption of unhealthy fats and heavily processed foods, as these can contribute to plaque buildup in your arteries. Engage in regular physical activity. Aim for a minimum of 30 minutes of moderate intensity exercise on most days of the week to keep your heart strong. If you are a smoker, quitting smoking stands as the single most impactful decision you can make to safeguard your heart health. Effectively manage stress levels and diligently monitor and control your blood pressure, cholesterol levels, and diabetes, as these are key risk factors. When lifestyle adjustments prove insufficient in managing CAD, healthcare professionals might prescribe medications designed to lower cholesterol, effectively reduce blood pressure, or actively prevent the formation of blood clots. In more critical situations, specialized procedures such as angioplasty or coronary artery bypass surgery are employed to re-establish healthy blood flow to the heart muscle, ensuring it receives the oxygen and nutrients it needs. Angioplasty involves the use of a small balloon and a stent to physically open up blocked arteries, improving blood flow. Bypass surgery entails creating a completely new pathway for blood to efficiently reach the heart muscle, circumventing the blocked artery. Taking swift action and seeking timely medical intervention can significantly improve outcomes, save lives, and enhance the overall quality of life for individuals affected by CAD. CAD is serious, but knowledge and action make a difference. Healthy habits, good food, regular activity, and no smoking are your best protection. Modern medicine offers effective treatments, but prevention is always better. Start building heart-healthy habits now. They'll benefit you for life. Share what you learn and encourage others to care for their hearts. Your heart works for you every day. Give it the care it deserves. Prioritize your heart health for a stronger, brighter future. Remember, protecting your heart is one of the most important things you can do.